record. So to start off, I'd like to introduce Robert Karanofsky, who I am now going to add a spotlight. Dr. Karanofsky is an associate dentist in the Department of Dentistry at the Jewish General Hospital. Dr. Karanofsky obtained his dental degree from McGill University and completed a general practice residency at the Jewish General Hospital in 2014. As a full-time hospital-based dentist, Dr. Karanofsky treats patients from a variety of medical backgrounds. He's involved in teaching as a clinical instructor for dental students and dental residents. I also always wanted to preface any webinar with a medical professional, and I'm sure Dr. Karanofsky will repeat the same. We don't have access to your specific medical charts. For questions pertaining to your case, any medication, a condition, we always ask that you refer back to your oncologist or your dentist or somebody on your team, because they are most familiar with your case. So on behalf of Hope and Cope, I sincerely thank you, Dr. Karanofsky, for generously offering your time and who has come to speak with all of us today. We are very grateful. So I yield the virtual microphone to you.
Thank you. I'm just going to start sharing my screen. All right. All right, so I guess just technically speaking, if you can't hear me or see my slides, just let me know somehow.
Dr. Karanofsky, we can't see your screen. Oh, there we go. No, we can.
Oh,
no, we can.
There we go. All right, perfect. So thank you very much for the introduction. This is my third time giving a lecture for Hope and Cope, so thank you for having me back. I do enjoy talking about dentistry. So just a few little notes before we get started here. The lecture is entirely in English, but I am perfectly comfortable speaking in French. So if you have questions, si vous avez des questions, vous pouvez les demander en français. You can ask them in French, no problem. There will be a good amount of time for questions at the end, I promise. And there will be a slide with a bunch of resources and links that if you'd like. So just first off, I am not paid by any company whatsoever to promote their products. So the things that I'm mentioning, it doesn't have any conflict with me, all right? So a quick little outline of what we're going to talk about. So first off, general oral health, what kind of cancer treatments you might be going through, and what that does to the immune system. Dry mouth is a big topic that a lot of patients bring up as a secondary effect of many medications. And then maybe one of the most important things being communication. And as I said, there will be plenty of time for question and answers at the end. All right, so a little bit about general oral health. You know, obviously we want the gums to look nice and healthy. Teeth, no caries. Dentures, you want them to fit well, being retentive. You want to make sure they're staying clean. You want to have an infection-free mouth. Now, this slide really applies to anyone and everyone, but with cancer patients, a lot of these things can sort of become problematic if not in check. But really, anyone and everyone should have a healthy mouth. Okay, so this applies to everyone, but yes, there are some specific effects that do occur within the realm of being treated as a patient with cancer. And so we're going to talk a little bit about the types of things that might occur that you might really want to take a look at. So with cancer, there's obviously chemotherapy that can obviously cause issues with the immune system. Now, there are so many chemotherapeutic agents that affect the immune system in different ways. And I am not an expert on chemotherapeutic agents, but being a hospital-based dentist, I will speak to oncologists on a regular basis. And that is going to be one of the biggest questions that I'm going to discuss with the oncologist, is what the type of effects on the immune system are that might time different treatments accordingly. And obviously dry mouth is something that I know was brought up in a few questions. It's something that I address in a few slides. Also with cancer treatments, there's radiation therapy. Okay, so with patients who receive radiation to the head and neck area, salivary glands are not very happy with that, and their function is significantly reduced. So therefore, they do experience a significant amount of reduction in their salivary production. And so it's a big side effect with radiation to the head and neck area. It's something that we need to look at if patients are going to be going or have undergone radiotherapy to the head and neck area. So with a decreased function for your immune system, big increase in vulnerability for sores to be created in the mouth. And so we really want to catch these things very early if there's something that might be irritating the gums. I mentioned it earlier, if you have a loose fitting denture that's constantly rubbing up against the gums or the palate, it sometimes creates a situation where mouth sores are much more likely to develop. With regards to latent inactive infections, if you have something that's just lingering under the gums and it's just been sitting there stable for who knows how long, and you're going to be undergoing some form of chemotherapy that's going to decrease the function of your immune system, we really want to check and make sure there's nothing going on before your immune system is going to be affected, because it can obviously activate these infections and cause some major issues. So we want to make sure that these things are detected earlier and prior to chemotherapy. So dry mouth is something that is a very common side effect with many patients. One of the most common side effects of medications, and any medication, is dry mouth. So saliva has a lot of good functions that help protect teeth. And so if your mouth is drier, your risk of developing caries or cavities greatly increases. And I'm sure everyone has experienced it at some point in their life, but it's not very comfortable to have a dry mouth. I myself have a glass of water right next to me right now because it's not so comfortable to have a dry mouth, especially when you're giving a talk. So it's something that we're going to talk about here. So what can you do? So with regards to mouth sores, there's a whole bunch of things that you can try that help. One of the simplest things, and this goes for any soft tissue issues in your mouth, salt water with or without baking soda can be very, very helpful in keeping those areas nice and clean. It's something that I recommend on a somewhat regular basis to patients who have some form of sore. If a patient has a recent extraction, it's one of the things that we greatly encourage patients to do, is to rinse with salt water, keep those areas clean as they heal. As I mentioned earlier, fixing any loose dentures or any source of irritation that's irritating the gums, definitely something that we want to look at. Pharmacies have these gels like Oragel. It's something that you can put on a sore that will definitely help make you a little bit more comfortable. And obviously, any irritating factors like hot and spicy foods, alcohol, smoking, these are things that you're going to want to avoid if you have a sore or something, a soft tissue sore in your mouth. For dry mouth, there are probably hundreds of different products that you can get at any pharmacy. And a lot of them are trying to either replicate salivary function, like sort of these xylem melts here in the middle are probably one of my patients' favorite products that the pharmacy sells. Basically, they're these little, they sort of look like little mints. On one side, it's a white surface, and on the other side, it's a brown sort of like paper-like surface. And you basically just put this in your mouth beside your teeth, and it melts slowly over time, over an hour or two. And it sort of simulates as though your salivary gland is functioning regularly. I have a lot of patients who really, really like these products. Biotene is a company that has, of its own, it has plenty of products that are specifically for dry mouth, whether it be a mouthwash, some toothpaste. There are all sorts of a slew of different products. If you want to try chewing gum, that can help stimulate your salivary gland flow as well. This is xylitol. You'll see this on a lot of different products. It's a sugar substitute because obviously we're going to encourage sugar-free gum, and that can help stimulate salivary gland flow as well. This is a specific toothpaste that has a high concentration of fluoride. And what I mentioned earlier, when you do have dry mouth, your risk of developing decay is increased. And so fluoride is one of those things that if we introduce a lot more fluoride to the situation, it helps balance the risk for the teeth. I put a picture of a water bottle because it is probably one of the simplest ways to help with dry mouth, is just to sip on water throughout the day. I see patients who, basically any patient who undergoes radiation.
Dr. Karanofsky, I think we lost your sound for just a moment.
These are just a small sample of the tons of products that you can find at the pharmacy. If you like something, great. If you don't like something, don't stick with it. There are many others that can work. So with regard to fluoride, I mentioned, I guess, on the previous slide, the fluoride toothpaste here, the heavy the Prevident 5000, which has a high concentration of fluoride. Pretty much any of the major brands of toothpaste have fluoride in them. I obviously would recommend a fluoridated toothpaste. One of the questions that we received before was with regards to a toothpaste just irritating the gums. And it's something that I've heard several times from patients, is that with certain toothpastes, they find that their gums become sore, or it irritates their gums, or it burns their gums. I think what it is just an ingredient in some toothpaste that cause that irritation. And I just say, stick with a different toothpaste. If you want what I use, I literally go to the dollar store and I think I get the basic Colgate one. It's for me the simplest. But if you like a toothpaste and it works for you, it has fluoride, stick with it. If it's causing you issues because, let's say, you started a medication and your gums are relatively sensitive, just switch to a different toothpaste. You will find a toothpaste that you're comfortable with that has fluoride. Another thing that we often give patients, we recommend to patients, is this fluoride mouthwash. They come in different concentrations, and they come with different instructions as well. I believe the green one is actually indicated just being once a week. But again, these can be very helpful in delivering fluoride in situations where your teeth are vulnerable because of a dry mouth. With regards to our radiation oncology patients, we often prescribe these fluoride trays as well. And this is something that anyone can get if, I guess, your teeth are at risk. But essentially what they are, it's just these trays that fit customized to your teeth. We take impressions and make them on those models of your teeth. And we prescribe these gels that you put inside those trays. And you wear it for about 5 minutes a day just before going to bed, and it just coats your teeth with a nice layer of a high concentration of fluoride to help reduce your risk of developing decay on these teeth. All right. So if somebody's at risk, it's definitely something that I would recommend for them. That's probably one of the most effective fluoride delivery systems. So I think this is one of the most important points with regards to I guess, oral care with regards to oncology. Communication. You know, I mentioned just the list of chemotherapy agents that there are now. I don't know what all of them do and the effects that they all have. And even then, they may have a different effect for each individual. And so if I have a patient that I'm considering a certain therapy, or I think they need a certain treatment, and they're on some form of regimen with an oncologist, I'm going to speak to that oncologist for sure. And I think this goes for anyone, but I think everyone should really be on the same page. And communication is obviously the way that we get there. So just a few resources. I know this was probably rather quick, but it will leave a significant amount of time to get to people's questions. But a few websites here that you can go to that if you'd like. I'm assuming that Hope and Cope will have these slides available to you if you'd like to.
Dr. Karanofsky, we can't hear you, but
Sorry?
Oh, you cut out for a second. We couldn't hear you. I was just confirming that the slides would be available.
All right, fair enough. So I mentioned anyone and everyone should have a nice healthy mouth, and so this is my dog, and I brush his teeth regularly because he also needs to have a nice healthy smile. and he's a good therapy dog, and he takes care of me as well. So I will, I guess, stop sharing my slides so that I can open it up to questions, and maybe I'll go to the questions that were asked first. Does that make sense?
That would be great. I'm just trying to figure out how to spotlight myself, to be honest.
Okay.
We'll just go this way. So some of the questions that we received, and I think you took care of the dry mouth one, but what can somebody do to reduce the metallic taste in their mouth?
So that's a good question. It really depends on what the cause would be for that. Not entirely sure exactly in the scenario what causes that for this patient. There are, I know, some mouth rinses that if you use them over
Dr. Karanofsky? You froze for a second, but I think okay.
My internet connection is not great. Sorry.
I think you were just saying like different things can cause different side effects.
Yeah.
Side effects.
Exactly.
Great. Sensitivity. A patient reported having sensitivity on their tongue, difficulty eating hot foods. Is there anything they can do to help?
Yeah, so I sort of addressed this a bit earlier. If, some people are just become sensitive to certain stimuli. And so if you do have really hot foods and your tongue is rather sensitive, maybe there is something wrong with your tongue. I'm not gonna rule that out as a possible issue, but it could also be,
We lost your voice again. We can't hear you. Okay, now we hear you.
Oh man, this is no good. Okay, hang on. Let me see if I can do something to fix that. One sec.
No worries.
Let me see. Let me see if that's better. Did you get any of my answer or no? No.
Maybe let's just go from the top.
Okay. Sorry about that. So with regard to the tongue, some patients just might have some sensitivity to hot or spicy foods. And, if there is a sore on your tongue, well, that needs to be addressed. And so I would recommend getting that looked at some point just to make sure there isn't any issue with your tongue. But it could be, I have patients who are undergoing radiation and they just develop sores in their mouth and they can't eat certain foods for a certain period of time. So hopefully it's a temporary thing that will resolve over time.
Perfect. Somebody else asked, I recently started chemotherapy and immediately noticed more brown spots on my teeth. They come off with vigorous brushing, but I've never had this before. Is this normal? Anything I should do about it?
So staining is a very common thing with regards to teeth. There are so many things that cause stains on teeth. To specifically figure out exactly what's causing these brown spots on your teeth would be rather difficult. But if you are having dry mouth, that will probably predispose you to getting stains. But if they come off with brushing, that means they're rather superficial stains, and just having regular cleanings. If you do brush your teeth vigorously, be gentle. Don't brush your teeth too hard. You don't want to hurt yourself. And then having a regular visit with a dentist, hopefully as
You froze again for a second, but I think what you were saying was just like to visit a dentist to make sure that your mouth's in good shape while you are undergoing treatment.
Yeah.
So we've had a few questions come in to me directly on the side.
Okay.
So somebody asked, should we be seeing dentists in the hospital instead of our usual dentist? And I assume this means while they're in treatment.
So it's actually something that I've discussed recently with some people, but the truth is your dentist who follows you regularly, it's perfectly fine to see them. There's no...
You froze again. We can't hear you.
I don't know why I keep freezing.
You want to maybe try turning off your video, and then we can see maybe like if your Wi-Fi, that will help.
Maybe.
Okay.
All right. Okay, so let me try talking now, and if okay, so with regards to seeing a dentist, your dentist that's followed you is somebody that knows you and knows your history, your dental history, and I think that's something that has value. And so seeing a dentist in the hospital, you're more than welcome to, but following with your own dentist is probably a better idea. And if your dentist has questions, they should be able to ask your oncologist and speak to your oncologist, going back to that communication comment from earlier. Yeah.
Somebody else said, I finished chemo 6 months ago and I went to the dentist this week as I have cavities to take care of, and she found my gums bleed a lot. How long will this take to resolve?
So it depends on why your gums are bleeding. I mean, if you haven't had a cleaning in a while, there's a lot of buildup on your gums and there's a lot of inflammation. Having a good cleaning can help with that. That's usually the most common cause of bleeding gums, is that you're in need of a good cleaning because there's inflammation in your gums, and that should resolve relatively quickly.
During chemo, could we get cleanings at a general dentist appointment?
So again, it depends on what chemo you're getting, and that's a discussion that oncologist, patient, and dentist should be having together.
If you are receiving immunotherapy and you need a root canal, are there additional or any antibiotic prescribed?
Depends on the dental situation as well as the immunotherapy. Typically, immunotherapy is rather targeted, but again, I don't want to make too general of a statement. Again, I would go back to speaking to the oncologist to make sure that there's no issue. But generally speaking, immunotherapy is rather targeted treatment, and so it shouldn't be much of an issue. But again, the caveat being, I would speak to oncologist is always the right answer. That's
what I figured. We're trying to make sure that we ask the questions because I'm trying to gauge them, but again,
no problem.
Is it normal to still have dry mouth 5 years after treatment?
Tough to say exactly what kind of dry mouth you might be having, but yeah, some people who don't get diagnosed with cancer just suffer from dry mouth. So could it be a long-lasting effect from your treatments? Very possibly. It could also be just something completely separate. But there are people who suffer from dry mouth for their lives, and so I would recommend you try different products that make you a little bit more comfortable, because it's not fun.
Another question. There was 2 more questions about a specific drug and antibiotics. I'm gonna not ask those just because, again, we always, as has been mentioned, we'd always ask that you go back to your oncologist or your dentist, ask about a specific medication. And as Dr.
I don't mind answering this question. I think that you're talking about the last one here on Zometa.
Yeah.
I don't mind answering that question. I'm happy to answer that question.
Perfect.
With regards to Zometa, it does have a very strong effect on the bone, and so with regards to tooth extraction, it's not ideal. If you can keep the tooth in your mouth and not need an extraction, it's much more favorable. Now, there are scenarios where you don't have a choice. I've seen multiple patients on Zometa where we've done both, essentially. We've either had to try to save the tooth, keep the tooth at all costs with, as you put here in the question, with a root canal. And in some scenarios, you have no choice but to take out the tooth. The issue is with regards to the bone. Zometa is a drug that really prevents the turnover of bone to protect the bone from being fractured. And with regards to your mouth, if you have an extraction done, you want the bone to turn over and heal and change shape. And unfortunately, this is a very strong drug for the bone, and the bone does not heal typically very well. Now, again, I'm going to speak to the oncologist every time. So yeah, so. All right.
Anyone get their dental work done at the Jewish General Hospital?
Technically speaking, anyone and everyone can get their work done at the Jewish General Hospital. Yes. I mean, I've had patients come to me from, I think the last time I gave my lecture at Hope and Cope. You're more than welcome to call me. I won't say no to saying hello.
Perfect. There was another question, so if you can look in the chat about a specific medication, I'll let you gauge that one.
I'll be honest, I don't know that drug at all, so I'd have to look into that. And with regards to Prolia better than Zometa, Prolia and Zometa are, I'm going to say similar, but Prolia is typically given for different reasons than Zometa. Prolia is a drug that's typically given twice a year to prevent issues from osteoporosis, whereas Zometa is typically a therapeutic agent for metastasis to bone. So they're usually different indications for those two medications. I'm somewhat familiar with them just because they do affect the bone, and obviously I need to be aware of that when I'm taking care of patients. But typically those are not two drugs that you would be comparing.
Another question came in. Is it safe to get dental x-rays once a year after radiation therapy? So
anytime, I guess what I'm going to say applies to anyone and everyone. If I'm taking an x-ray on a patient, there has to be a reason for it. And so, you know, we don't just take x-rays for no reason. And so if you know you need those x-rays as either just a preventive screening or because you have some problem with a tooth and we need to assess what's going on, yes, there is absolutely no reason not to get an x-ray 1 year after radiation therapy.
Thank you. Does anybody else have any other follow-up questions that maybe we didn't get to? We have some time to take any questions. As mentioned, this lecture will be up on the YouTube, our YouTube channel, so we can always pause and kind of see those lists of resources that Dr. Karanofsky outlined for us. If there's any questions? What if your another question, I'm sorry.
Okay.
More questions. What if your dentist requests x-rays for annual checkups?
So, you know, there are different times that you could be taking x-rays for checkups. And it's based on your individual risk. And so what I mean by that is if I have a patient who every time they come to see me, they're developing more and more decay, well, I'm going to be taking x-rays more frequently than somebody who has perfectly healthy, clean teeth and is at a low risk. And so if you're at a high risk, having x-rays on a regular annual basis isn't uncommon. But it's really an individualized question. So it depends on you, essentially, how often you need those x-rays. The next question here, if you have a root canal, is there a problem to put a post in the bone? That's okay. I'm not really sure what the question's asking because typically the post would be put in the tooth, I believe, if that's what you're asking. But having a root canal in the tooth, you can put a post in that tooth thereafter to build it back up, yes. But with regards to a post in the bone, if you're talking about implants, having a root canal, I'm not sure if that question I'm not sure what the question's fully asking. Is it safe to get x-rays shortly after a CT scan? Again, go back to my comment of if you need those x-rays, yes, there's no reason not to take x-rays of your teeth if you need them. I don't take x-rays for no reason. I take x-rays to diagnose and to check on things when they're needed.
There, we have a patient who takes very good care of her teeth, but is concerned about osteonecrosis of the jaw because of the medication she's taking. Is there anything she can do to prevent this?
Regular maintenance and follow-up with a dentist is the most important thing to do, because if any issues do arise, you catch them early, long before you would need major dental work, and that would definitely reduce your risk of developing any osteonecrosis. I stress that anyone and everyone should really be followed at least once a year by a dentist, sometimes more often depending on your case. But yes, that is a concern with regards to that medication.
And is there like any specific toothbrush or water pick patient should be using?
Toothbrushes. So, people often ask me, what do you recommend as a toothbrush? And my answer is typically the same. If you come to see me and your teeth are perfectly clean, your gums are happy and healthy, the truth is I don't really care what you do at home because it's working. If you come to see me and there's a lot of buildup and there's a lot of plaque and there's a lot of inflammation, obviously something needs to change. With regards to water picks, I've seen patients who use them and love them, and it does wonders for their gums. And I have some patients who use them and their gums aren't necessarily in the best of shape, and we need to change something. So it really depends on you. What works in your hands might not work in somebody else's. With regards to toothbrushes, I am often asked about whether or not people should use an electric toothbrush. Truth is, I had an electric toothbrush and I went back to using a manual because I preferred it. But if you're using a manual toothbrush and it's not doing the greatest thing for you, or if you have limited mobility, yes, electric toothbrushes are great. So it really depends on you.
Any final questions? We still have some time. Do you have any advice on how to avoid mouth sores for patients? Let's just go with patients.
All right. So for patients, avoiding mouth sores is sometimes challenging because our mouths are not like the most friendly environment. If you think about all the different things that we eat, and we're exposed to hot, to cold, to spicy, and sometimes one after the other. Obviously you're going to eat. And so sometimes if your mouth is more vulnerable and susceptible to developing sores, unfortunately they can happen. But really avoiding mouth sores is really, I guess, about being careful. As I mentioned before, avoiding hot, spicy foods while your mouth is vulnerable. And those few things that I mentioned in terms of salt water. If you have a loose denture, then you want to have that adjusted and make sure it's retentive. Can I talk about magic mouthwash? That's a very vague question. Can we ask a more specific question on that? What do you want me to say about magic mouthwash?
I think.
Is it only available? I actually don't know the answer to that question, if it's only available by prescription. So the truth is, you can actually, we can prescribe different formulations of mouthwashes as well, with different types of products and different types of things depending on the situation. So I know that certain formulations, yes, you'd need a prescription for, but with regards to all magic mouthwash, I don't actually know the answer to that question.
I bite my gums and then get a mouth sore. How to avoid biting teeth?
There could be a few answers to that question. You got to be careful, obviously. Sometimes if, for instance, I put in, it's something that I tell patients, if you have recent dental work, sometimes you want to be careful if there's a big change to a tooth or to your bite. I tell patients to just take it easy the first few times that they eat. But if you're always developing a mouth sore because you bite your gums in the same spot, it might be a good idea to have it looked at and see why that's happening in the exact same spot. Sometimes people develop these growths in their gums that are completely benign, but they're just constantly in the way of your bite. And sometimes just having a little, to remove that little excess tissue can go a long way if that's the reason. With regards to how much salt you should put in the water, typically I say about a half a teaspoon into a glass of warm water, and that works as salt water. And you can do that 20 times a day if you really like, by all means, and it really helps with soft tissue issues. How many times per day should we brush? So I go back to what I said about if a patient comes to see me and their teeth are perfectly healthy and they're, if they're brushing 6 times a day, by all means stick to 6. But if they're doing it with 2, then that works for them. The general recommendation is to brush twice a day, morning and night. If you want to brush in the middle of the day, by all means, go right ahead. Yeah, I mean, it's
I think we lost you for a second, but we went a while without losing you. But I think what Dr. Karanofsky is saying is to do what's best for you and what works for you.
I think I got frozen again.
You did, but it was the first time.
Well, all right.
But I think we got most of what you were saying, kind of.
Okay.
What works for you. They recommend 2 a day. If you want to do more,
Yeah.
today you can do that as well.
I ended by saying my personal routine is twice a day. Yeah.
A patient bought an electric toothbrush with a 2-minute setting. It was a lot longer than I used to brush. An eye opener for me. Yeah.
So typically the recommendation is to brush for 2 full minutes. It sounds like not very long, but it is a long time. And a lot of those electric toothbrushes come with a little timer, and it tells you, do this quadrant and then that quadrant. And 2 minutes might seem like a lot. If I'm going to be very honest with you, I doubt that my length of time that I brush my own mouth is 2 minutes each time. But knock on wood, I guess it works for me. But yes, the recommendation is 2 minutes.
And I'm thinking with COVID, they told us to wash our hands for 20 seconds or have
Yeah.
Everyone was so shocked at how long that was.
Yeah.
Somebody asked, could biting our cheek or getting a sore have anything to do with grinding our teeth and not realizing we grind our teeth?
Typically, biting your cheek very often sometimes has to do with the way that your teeth connect when you bite. If there's a little bit of a gap sometimes, or if your teeth don't overlap in the quote unquote proper way, sometimes it's just prone to getting your cheek stuck in there. So it's more let's call it anatomy, or the way that your teeth interconnect, that might predispose you to having your cheek constantly getting bitten.
I think also sometimes from personal experience, you bite your cheek once and you're out for like a week because you just keep biting the spot.
It's kind of a downward spiral because it gets swollen and bigger, and then you're much more likely to bite it over and over and over again. Yeah.
Great. Any other questions? They're great questions. I think that they're helping a lot of people. We'll give it another few seconds. If there's no other questions, again, this will be recorded and put on our YouTube channel that, of course, we encourage you to check out. We have a lot of informative webinars. Once again, Dr. Karanofsky, thank you so much for taking the time this evening to meet with us and to answer our questions, all of our questions so kindly. I think we can all take away from this webinar that check in with your dentist, make sure all's good. If you are a patient, your dentist, if necessary, will be in touch with your oncologist. Your medical team is the one who has your file, so ultimately they will make the best decisions for you. So we thank you so much, everybody, for participating in this webinar, and we wish you all a wonderful afternoon and evening. Thank you, guys. Thank you, everyone, so much.